Hello and welcome. My name is Dr. John Dombrowski, Washington Pain Center. I want to talk to you today about chronic pelvic pain. First thing we talked about were injection techniques that can be used. There's certainly medications that we can talk about. But more importantly, I'd like to talk to you today about spinal cord stimulation for people with refractory chronic pelvic pain. There's a lot of literature out there that does demonstrate this can work very well for patients. Again, what is spinal cord stimulation? Very simple. It's a pacemaker for pain. It involves a battery and a computer. It then involves an electrical lead. The electrical lead then can be placed in two places. First, in between the backbones and on top of the spinal cord. And normally around T7 seems to be a pretty good spot. We've recently done some studies that shows that's fairly good for catching low back and especially pelvic pain. The other way that was traditionally done is actually putting the leads going south, down in the sacral area. So you'd have to put the needle in, instead of the needle at a 45-degree angle going opposite direction, you want to go down, so it needs to be down this direction. As the needle goes in, the leads then are brought down into the sacral area and stimulating the pelvic regions going down into the sacrum. Be very helpful. And again, the majority of these patients can do exceptionally well because the patients can try out this procedure to see if this helps them. That's the reason we do a spinal stimulator trial. You go home with it, try it out for 5 to 10 days, see what works for you. Again, it's a great experience. It can open some doors to help you get your life back. Thanks for watching.